Okay, well, welcome everyone to this today's webinar with Lifeline. My name is Christine Hallam and I'm the Events and Membership Coordinator at Connecting Up. And thank you everyone for registering and attending today's webinar. With me today I have Carly Douglas, who is the ICT Services Manager for Lifeline Australia based in the ACT. And today she'll be presenting a case study on how Lifeline has implemented the cloud in their organisation through the online crisis chat system. Before I pass you on to Carly, just a couple of housekeeping notes, especially for those of you who are new to the webinar. We won't be taking any live questions, but if you do have any question you would like to ask Carly, please type them in the question box and I will address them and moderate all your questions at the end of her presentation. So we'll let Carly finish her presentation, but if you have any question along the way, type them in and I will just read them out at the end. Also to let you know that we are recording the webinar, so you will get a link to the recording afterwards, so you can still access the session and the slides afterwards and share it with your colleagues. So I will now just hand it over straight to Carly to begin. Carly, are you there?
I am. Thanks, Christine.
No worries.
Okay, thank you for all attending today. My name's Carly Douglas, and as Christine said, I'm the ICT Services Manager at Lifeline Australia. I've been working at Lifeline for about 18 months now, and I feel honoured to work for an organisation that provides such critical services to Australians in need. So what does Lifeline do? Lifeline's a not-for-profit organisation that provides access to crisis support, suicide prevention, and mental health support services across Australia, both via the use of national and local community services. Lifeline was founded in 1963 by Sir Alan Walker after he took a call from a distressed man who later took his own life. Alan was determined not to let isolation and lack of support be the cause of more deaths by suicide, so he began the journey of a 24-hour crisis support line and Lifeline. Lifeline is now providing services across all states and territories, with Lifeline centres in over 40 locations across Australia. So Lifeline provides three key areas of crisis support on a national basis. First is Lifeline's core service, our telephone crisis support, or 13 11 14. This is a confidential telephone crisis support service available 24/7 from a landline, payphone, or mobile. This service is currently provided using on-premise contact centre technology. Second is our website, a pathway to services promoting emotional health and well-being, including self-help guides, stories, coping kits, and a local and national service finder. This website is an on-premise solution and is available to the general public 24/7 at lifeline.org.au. Last but not least is our online crisis support chat, a confidential, one-to-one online crisis support chat service. The chat service is hosted in the cloud and is the case study I'll be focusing on for today's presentation. So let's look at our crisis support chat in a bit more depth. Lifeline's online crisis support chat service was originally trialled for a 5-month period during 2011. The service was provided each evening during the hours of 8 p.m. and midnight, Australian Eastern Standard Time. During this trial period, Lifeline used a cloud-based software. The software was already tailored for use for crisis support and was being used by companies similar to Lifeline within the US. The chat trial was a success and contact was made with almost 1,100 people throughout the trial period, most of whom saw an improvement in their mood after the chat. A decision was made to commence a permanent service from May 2012 after the findings of the trial. So I've mentioned that our trial crisis chat service was cloud-based or located in the cloud. Some of you may be asking, what do you mean by in the cloud? When we talk about the cloud, we are talking about cloud computing. Cloud computing is a very broad term for the IT systems accessed via the internet with the various components run by an external party. This means that you do not own anything other than the data that you load into the system. Cloud computing's three main components or elements are software as a service, which is also known as SaaS or sometimes software on demand. Typically, this is a software you use to run your business or a component of your business. You access this software over the internet and you pay for what you use through a subscription. This component is where the data resides, remembering you own nothing but the data you load into the system. The software is delivered on a one-to-many model and users are not required to handle software upgrades or patching. An example of software as a service is Salesforce, a CRM application accessed via the web. Software as a service is what I'll be primarily focused on during today's presentation. Secondly, there's Platform as a Service, or PaaS. This is essentially a computer platform and the framework you build your software applications on. So it contains things like your operating system, your database, etc. Platform facilitates the deployment of applications without the cost and complexity of buying and managing the underlying hardware and software, or provisioning hosting capabilities yourself. There are various types of platform vendors. However, all offer application hosting and a deployment environment along with various integrated services. An example of this is Force.com, the platform that Salesforce sits on. Lastly is Infrastructure as a Service, which is also known as IaaS or Hardware as a Service. This delivers computer infrastructure as a service and is transparent to the end user. You could think of this as the actual box or server, remembering, however, that it could be any type of equipment, for example, storage, hardware, or networking components. The service provider is responsible for housing, running, and maintaining this equipment. Often, virtualization is used, and that, coupled with the cloud, provides a flexible and on-demand solution. There are a number of IaaS providers, however, for example, Rackspace or HP Cloud. So, as you can see from my diagram, the software component is what the business user is interfacing with and generally all that they see. Again, this is where the data is stored and also where the majority of risk, complexity, cost and governance issues reside. The platform and infrastructure layers are almost invisible to the users and are generally of little interest, provided that the systems are stable and they operate within the acceptable performance. So, why would you choose a cloud-based solution? The cloud has the opportunity to lower IT operational costs and the total cost of ownership. Sometimes up to a third or half of the cost can be saved by using a cloud option. Provide flexibility and scalability. Improve IT productivity. Foster innovation. Speed up deployments. Simplify complex IT environments. And give the business more ownership of the IT systems. Software as a service has added benefits, including the fact that it can be available almost immediately, which essentially allows you to try before you buy. What do I mean by that? Well, as the system is available almost immediately, it gives your organization the opportunity to buy a small amount of subscriptions and literally try the system out. If it does not meet your needs, you can walk away after little cost or investment. This sounds perfect, right? Well, at face value, cloud computing can appear to be an extremely compelling offer. However, governance, cost, and risk considerations must be closely looked at and understood by your organization before considering the move to the cloud. We've all seen it before. A non-IT business manager is shown a fancy piece of software based in the cloud by a salesman. It looks pretty, they tell you how quickly it can be deployed, and they show you how easy it is to use. Before you know it, the contract is signed. Were governance, cost, and risk considerations aired and actively discussed with your organization? Probably not. Will the system deliver tangible and sustainable value to your organization over a period of time with known cost and risk? Maybe. Let's look more at the governance, costs, and risk associated with moving to the cloud. In order to objectively assess the risks, you need to expose and understand all known risks that relate to your organization. You should be asking questions like, what is the reliability, longevity, and stability of my vendor? This is a big one to assess, and you should perform a thorough reference check process, asking questions like, how reliable is my vendor? How long have they been providing this service? Do they provide this service to anyone else of similar nature to my organisation? And could my vendor go out of business? And what will happen if they do? How about my data? Where is my data located? How easily can I access it? Who else can access it? And can I get my data back easily if we need to move it somewhere else? What are our support and maintenance arrangements? What uptimes do we require? Who will support us and how? And do we need 24/7 support, and can it be provided? How about the disaster recovery and business continuity plans? Are they in place? What if there's a natural disaster? Does it cover that? Cost. What type of licensing arrangements do we need? For example, named or concurrent user licenses. And what unexpected costs could we encounter? For example, if we have a major change in our user pattern, exchange rates, or inflation. And of course, what about a cloud computing policy? Should we have one? The answer is yes, by the way. Governance is important to prevent viral, uncontrolled, and unapproved implementations of cloud applications, like the example I provided in the previous slide. This policy should clearly articulate the controls and accountabilities for things like approval, purchase, implementation, and use of any cloud-based applications, no matter how small. So back to Lifeline's case study. Why did we choose the cloud for our online crisis support chat? Firstly, the ease and speed of setting the service up. We knew that the time it would take to set the software up would dramatically decrease by using a cloud-based option. Flexibility and scalability. Whilst we were unsure what the demand of the system may be and how long funding was assured for, a cloud-based option gave us the flexibility to scale up or down the system quickly and easily. Total cost of ownership, seen mostly in the IT and operational costs. And it allowed us to bring less complexity into an already very complex environment, which therefore reduced the reliance on our skilled staff, leaving them to remain focused on other strategic objectives of this organisation. So, we understand what the cloud is, we've explored all aspects, we've mitigated known risks and considered possible or likely costs. Now we need to select a vendor. There were many services in the market that could easily provide a one-on-one chat service, MSN and Google Chat to name a few. However, Lifeline was in a unique position. Not only were we providing the first one-to-one online crisis support chat service to Australians of all ages, Lifeline also had a number of unique requirements, which meant that we were looking for a fairly tailored service. 7 of our key considerations were, 1, the criticality of the service. During the trial, a high level of suicidality was seen, making this a very critical service and also meaning that emergency services may rely on information captured within the software for interventions. 2, the data that needed to be captured and stored. This included information like the help seeker's mood, both pre-chat and post-chat, the help seeker's demographic data, and the chat transcripts. 3, the privacy laws and governance related to the storage of the data we were capturing. This was a big one for Lifeline. You need to remember that depending on your cloud provider, your data may reside overseas and therefore be subject to one or more international jurisdictions. 4, the option of in-queue messaging. Lifeline was looking to provide help seekers with guidance and support whilst they were waiting in the queue to chat to a crisis supporter. 5, the application of Lifeline's practice model and whether or not we were able to integrate with our current CRM, which guides users through the appropriate steps. 6, whether or not the option of supervision and coaching was available. And lastly, how our crisis supporters would access referral information to provide to help seekers throughout the chat. Based on Lifeline's needs and the due diligence work we carried out, we were able to engage a vendor who met our needs, and Lifeline was able to start the setup process. Using a cloud-based offering meant that we were able to configure and implement the online crisis support chat within a very short period of time. There was no need to buy, install or configure the hardware, nor was there any need to install operating systems and configure databases. The only work Lifeline had to carry out was some tailoring to the software, which included the configuration of a discrete layout allowing users to chat with privacy, a pre-chat survey and post-chat survey, which captures the help seeker's details, unless of course they choose to remain anonymous, their demographic data, and details regarding their mood prior to and post participating in the chat. In-queue messaging, offering access to other services whilst the help seeker is in queue. A set of canned responses for use by crisis supporters, for example, a consistent welcome message. The availability of supervisor access if required, and a CRM mock-up, allowing us to capture the required information for reporting. So where are we now? The online crisis support chat is now being run from 3 locations across Australia. Each evening, 10 crisis supporters are available to take chats between the hours of 8 p.m. and midnight. Crisis supporters are able to take a maximum of 2 chats at any given time, and Lifeline crisis supporters chat with over 2,000 Australians in need per month, some of which never felt comfortable previously reaching out for crisis support via other means. The online crisis support chat service has recently been selected as a finalist in the 2013 Australian and New Zealand Mental Health Services Achievement Award in the category entitled Innovative Use of Technology. So what lessons did we learn throughout the whole process? Firstly, be diligent in establishing and managing your contracts, including very explicit service levels. Use an established vendor who is providing their service to an organisation similar to yours. Keep it simple. You can always scale up. Get the basics right to start with. Ensure the vendor you're using has solid management processes, frameworks and methodologies, including issue management, change management and clear development methodologies. Lastly, ensure the system can completely cater for your organisation's needs. For example, if you require the system to be available 24/7 and the vendor has a 1-hour maintenance scheduled each evening, are you able to continue providing your service 24/7? So what does the future hold for Lifeline and the cloud? At this stage, Lifeline continues to provide 2 of our 3 core services via on-premise solutions. Eventually, Lifeline would like to deliver all 3 of our core services via the cloud. However, due diligence work undertaken so far has not given Lifeline enough confidence to move to a cloud-based solution yet. The complexities and criticality of Lifeline's current on-premise solution, especially our telephone crisis support service, coupled with the lack of evidence-based information for the offerings of cloud-based contact center technology, means that Lifeline will continue to provide our telephone crisis support service using an on-premise solution. Cloud computing has huge potential for Lifeline as an organisation, and we look forward to adopting the technology further once our risk, cost and governance concerns have been adequately met. Thank you for listening to my presentation today. I'll hand it back over to Christine, who is going to moderate the questions.
Great, thank you, Carly. We have a couple of questions here, and just a reminder for all of those who missed out the introduction, please type your questions in the question box and I will address them one by one. So we have a question about data security from Sylvia. How secure is your data? Is the hackability potential higher if you use the cloud?
Oh, hi, Sylvia. This was a big one that we needed to look at, and we had our security expert go into this in a lot of depth. Like I said, when assessing your cloud provider, you need to look at all of the different options around your data. So where is it being stored? How secure is it? How easily can you get it back? Where is it located? So going through a thorough process with your vendor and probably doing your internal checks with regards to that would probably be your best option, and doing thorough reference checks.
Thanks, Carly. In relation to that security question, Jennifer is asking about a similar thing. Has maintaining confidentiality been an easy issue to address? So if you have the idea of online crisis support for those with internet access is great, but for people escaping domestic violence, how could we ensure the perpetrator couldn't become privy to online crisis support?
Oh, hi, Jennifer. Using our online crisis support chat, we've tried to make the interface as discreet as possible. I guess that's a bit of a clinical or practice issue, and we have subject matter experts in-house to answer questions based on domestic violence issues. However, I think allowing the use of an online crisis chat as opposed to a telephone crisis support line allows them a more discreet option to talk to a crisis supporter.
So there are a couple of questions here about the actual solution that you end up using. So can you give us information and explanation on which software do you end up using, what are the platform solutions, and the specific cloud service option that you end up going with?
Sure. I haven't actually spoken to our vendor about whether or not I'm allowed to talk more in depth about the solution that we ended up going with. However, if you take the details for those people, I'm happy to double check with our vendor and then perhaps give them a bit more information about them.
So I will do that. So for those of you who particularly asked about that solution, Carly will get back in touch with you directly with some information. Cost is always a question. Are you able to talk about indication of cost?
So as I mentioned, we're paying on a subscription basis. It's actually quite a small cost in the end, which is obviously a good thing for a not-for-profit organisation. I didn't actually go through the process of dealing with the vendor directly with regards to the cost, so I'm not sure whether we were offered a discount due to us being a not-for-profit. However, I could put people in touch with the project manager of this project who dealt with the vendor directly.
Sure, thank you. So Liz was asking, what was the main change management challenge?
Oh, hi Liz. We had some issues with regards to a vendor that we originally looked at using. They didn't have solid change management and development methodologies in place, which meant that changes were being made in different environments without our knowledge. This just didn't give us the confidence in using that vendor on an ongoing situation. And that's one of the reasons why we went with the vendor that we have gone with.
Great.
And not the original vendor that we were looking at.
Okay, sure. A question from David. You mentioned a lack of confidence in moving other services to the cloud. Could you please go into more detail on what those concerns were?
Oh, hi David. At present, I believe that it's something like 93% of call centres are still, in Australia, are still an on-premise solution. Our call centre is also a very complex environment. We have, at any given time, probably about 2,000 to 2,500 crisis supporters who provide our support, telephone crisis support across the country. This makes for a really interesting arrangement and obviously provides a lot of complexities. Also, there's a lot of risk involved with our crisis support line. It's 24/7 and it's a highly critical service. So at present, I think they're some of the main issues and reasons we haven't moved across. that coupled with the lack of evidence-based information of contact centres in the cloud at present.
Thanks, Carly. Just a couple of other questions here. Can you have multiple users of the same program at once, for example, CRM?
Absolutely, yeah. I mean, we have 10 crisis supporters each evening using the software. But you know, some of these offer huge numbers, and I guess that's where the scalability of the services are a real added benefit. You can start small and scale up.
So, still talking about the CRM area, so are you using a cloud-based CRM? I think you mentioned it before.
Yeah,
as
we
well.
are. Sorry, yes, we are still using a client-based CRM. One of the guys, our technical guys in-house, built a Java app that just calls to that CRM, but yeah, there's more than one user of it at any given time.
Great. Someone asked, how easy or hard was the transition from your service to the cloud?
Yeah, it was a very simple process. I did go through this in one of my slides, which talked about how quickly and easily we were able to do so. So it was a very quick process. It actually only took just over a month. I guess the reason being is that we didn't need to buy, install, or configure any hardware. We didn't need to install operating systems or do anything like that. All we really needed to do was jump in and make some tailoring and configuration changes to the software we were using, configure the appropriate licensing, and we're up and ready to go, yeah, within just over a month.
So are you also, or have you also moved storage documents, admin data to the cloud? And what is your data backup procedure? Do you back up to your local server, for example?
So the only data that we actually capture is the data related to the chat service. So it's the pre-chat survey and the post-chat survey, the CRM type data and the chat transcripts. And yeah, we do bring them down into our data warehouse.
So how do you manage access by users after they're no longer in your system?
It's just a standard user management process. When someone leaves the organisation, we ensure that we disable their accounts and they're no longer able to access the system. We've also locked the system down to only be able to be used on specific computers, so those computers that are used to perform the crisis chat support service. So that gave us a bit of added security.
So do you need to save files as low resolution to manage bandwidth when using remote access?
I don't think that question really relates to our online crisis support chat service. We're not really saving any files locally.
But going back into, I guess, internet arrangement, do you need to make particular arrangements with your internet provider to ensure you have reliable internet, given everything is relying on the cloud for that particular system?
Yeah, absolutely, and it depends, I guess, on what service and software you are using. That's a good one to discuss with your vendor. They should be able to give you the configuration requirements that you'll require, so things like, you know, how big your bandwidth needs to be, depending on the amount of users who are using the system.
Did you find any Australian-based solutions, and like due to privacy laws, have you opted for a provider that has storage in Australia?
Yeah, this was a really difficult one for Lifeline, and I guess it was one of our big drivers in our vendor selection. I can't remember the exact specifics, but I believe we're not storing our data in Australia, but it is we are storing it somewhere perhaps like New Zealand, which has the exact same data laws as Australia does. I can find out some more information about that for people as well.
Great, thanks. Question in terms of the actual chat system itself from Nick. How integrated is the chat system into the rest of Lifeline's business? What other systems does it integrate with, and what issues did using a cloud-based system highlight? And can you book sessions for a specific time and date, or is there just a queue?
Hi, Nick. I'll start with your last question first. So the crisis support chat's available from 8 p.m. till midnight each evening. It's a queue-based system, first in, first out, and there's no option sort of for a callback service at present. I guess we'd look to expand the system in the future, but that's based on funding that's available at the time. The only system we're really integrating with is our CRM. There were some complexities around that when we were first configuring it. However, they were dealt with fairly easily internally. And that's the only other system it integrates with.
Great. Thanks for that. A question from Kerry. You say that emergency services may rely on your data captured. What arrangements are in place for that?
That's more of a, I guess, a practical issue. There's arrangements set up with the local police services within each state. If people are interested in some more information around that, I can set up a meeting with our support services within Lifeline who deal directly with those emergency services.
I will send through those information. So just a reminder for everyone, the bits when Carly said they will contact you directly, so we will do that offline for a bit more detail because of the things that she needs to check a bit more with some of the project managers. Just a couple of last questions here. You talked about before data security and everything and finding out those information. Did you find those out from the vendors that you consulted with in terms of where it's stored, or did you do on your own research?
I guess there was a bit of both. When we were initially looking at vendors, we went out to organisations similar to Lifeline and organisations, for example, in the US who are providing a similar service. And we just sort of asked them what their lessons learned were and what they did around data, that type of thing. We also sought legal advice with regards to the data capturing, and then we went out to vendors to see what, how they stored their data, where they stored their data, what the jurisdiction laws were around the storing of the data, and looking at the security and the accessibility of the data.
Great, thank you. A couple of just one of the last questions here. How hard do counsellors find the transition to online chat? Do they only get rostered onto online, or do you mix up online and telephone-based counselling?
Again, that's probably a bit more of a clinical or practical question. All crisis support chat supporters need to go through our standard training processes, and then they receive some extra training before moving across to the crisis chat support service. We've had some feedback, but I sort of more work in the technical area as opposed to the practical area. Again, I can put you in contact with someone within the business who has more dealings with the actual crisis supporters.
I think related to that question also, again, which can be addressed a bit later, but have you considered online video chat servers? Do you know whether that's something that has been discussed?
I think we're always looking at ways that we can expand the crisis support services that we provide. Again, it comes back to things like funding and demand. At the moment, I think we're just going to continue to provide our online crisis support the way it is. But yeah, we're always looking to branch out in other ways that we can reach those people in need.
Thank you. I have a last question here from Ella. Are users generally comfortable with the new technology that's been implemented?
Sorry, Ella, do you mean the actual crisis supporters or the help seekers?
Ella, if you can clarify that, that would be great. Oh, help seekers, sorry. Yep.
Yeah, I think generally the help seekers using the crisis support chat are quite comfortable with technology. There aren't really that many issues that are experienced by them. The main one, I think, is probably using mobile devices and them going out of service and losing contact with the help seekers. When that happens, we just ask them to connect back as quickly as possible.
Great, thanks, Carly. That was the last question. We do have a fair bit of time still. Does anyone have last-minute questions? Otherwise, just to let you know that I think a few weeks ago or last week, we did a general introduction to the cloud computing and just the basic benefits and risks. And so I will send you the link to that recording for you to catch up on if you didn't actually attend the webinar. That will give you a bit of more an overview on how to select vendors, what kind of things to take into consideration before you look into moving to the cloud. But also to let you know, for those of you who are based in Sydney, Melbourne or Adelaide, we have a cloud workshop next week, Tuesday, Wednesday and Thursday in Melbourne, Sydney and Adelaide. So if you're interested, already considering about moving to the cloud, this workshop will actually tell you a bit more, provide you with tools and resources and how you can do the planning transition smoothly as well. I think we don't have any more questions. So I'd like to take this opportunity to thank Carly. Thanks, Carly, for the presentation. And thank you to everyone who attended and participated and asked the questions. We will get back to you with some of the follow-up, as Carly mentioned. And if you do have any further questions about this, please feel free to contact us. Thank you and enjoy the rest of your day. Bye.